Hi, good evening. I am Dr. Parth Goyal. I am a consultant psychiatrist at Parth Hospital, Ahmedabad. Today we are going to talk about some of the myths and misconceptions which surround electroconvulsive therapy or ECT as a treatment option. The first and the most common myth is ECT is a very painful procedure. Electric shocks are given during this procedure. The truth is, ECT is not a painful procedure. ECT is a procedure which is done under short general anesthesia. That means that while the procedure is being performed, the patient is anesthetized. This anesthesia is similar to the one that is given during any surgery, which numbs the effect or which makes the patient completely unconscious during the entire surgical procedure. Hence, ECT is not something which is painful. No patient will experience or realize anything associated with ECT since the entire procedure is done under anesthesia. Second myth, ECT causes permanent brain damage. ECT does not cause any brain damage. ECT works by stimulating the neurons, that is the basic cells of the brain, in order to perform better. A lot of psychiatric illnesses are associated with neuronal dysfunction, as a result of which the biochemical balance of the brain is reduced or altered. For example, in patients with severe depression, neurons are not secreting enough serotonin, as a result of which patients are not able to experience happiness or pleasure. In such cases, when ECT is delivered, it acts on the underlying neurons, not on the brain structure, to help them secrete more serotonin and hence bring a relief of symptoms. Myth number 3. ECT erases memory or changes personality. Let us address this very carefully. There are two components to it. One, ECT erases memory. ECT does not erase memory. ECT causes something known as retrograde amnesia. Retrograde amnesia is the inability to recall events that have happened in the past. Typically, retrograde amnesia with ECT can last from a few days to a few months. However, this retrograde amnesia caused by ECT is temporary in nature, and all patients tend to recover entirely from the effects of retrograde amnesia. The duration of recovery can be variable from patient to patient and is affected by a number of factors such as the number of ECTs given, the dose of ECT given, the age of the patient receiving ECT, or any other neurological problems that the patient might have. Typically, patients recover in a span of 1 to 3 months and can go back to their earlier state of function. Please note, typically ECT only causes retrograde amnesia. It does not affect IQ, and it does not affect skill set, and it does not affect a person's ability to learn new information or pick up new skills. Also, the effects of retrograde amnesia are temporary in nature and can last anywhere between a period of 1 to 3 months. ECT causing personality changes. Typical myth is that if we were to give ECT to a patient, they will actually worsen and become more aggressive. ECT is not the cause, it is the treatment. ECT is a treatment for various psychiatric illnesses which can cause significant personality changes or disturbances. In my experience of treating patients over the past 10 years and giving more than 12,000 ECT sessions, there has been no impact on the underlying personality of a patient receiving ECT. ECT is a safe, effective, FDA-approved, and one of the oldest treatments for severe psychiatric illnesses ever invented. Myth number 4. ECT can only be given to certain specific people. ECT is a treatment option which can be given across age groups and across patients. There is no absolute contraindication to the procedure. Pregnant women, elderly patients, patients with cardiovascular illnesses, patients with lung-related issues, permitting anesthesia, can safely receive ECT when given in an equipped and competent setup. ECT should not be reserved till the condition becomes absolutely unbearable. Early use of ECT helps reduce the burden of illness, improves the time to recovery, and helps people live a near normal and good quality life. Thank you. I hope you found this informative. Please speak to your therapist or your psychiatrist to discuss ECT and its related issues in greater detail.